Hello, I'm James Altunkaya, and I'm going to describe some recent work with colleagues from the Health Economics Research Centre and the Oxford Department of Psychiatry, which examined the quality of economic models for severe mental illness. Severe mental illness describes people with psychological problems that are so debilitating that they can't engage in everyday activities. This often applies to people with schizophrenia, bipolar disorder, and some forms of major depression. People with severe mental illness typically have poor physical health, with high rates of preventable chronic disease such as diabetes and cardiovascular disease. This means people with severe mental illness have significantly reduced life expectancy, 10 to 20 years shorter in high-income countries, or 30 years shorter in low-income countries. This research examined the quality of economic models used to assess the value of new interventions for people with severe mental illness. Severe mental illness often endures for long periods of time, during which people affected have very poor quality of life and receive significant support from healthcare providers and wider society. Economic models are often used by government healthcare agencies, industry and researchers to assess the value of new interventions, as they combine evidence from lots of different sources to estimate an intervention's likely impact on quality and length of life and the costs of care to health services or insurers. We found 15 patient-level economic models of severe mental illness, which had multiple deficiencies. No model's design was complex enough to capture the events a patient with severe mental illness was likely to experience, including events which would affect that patient's long-term benefit from a new intervention, and therefore its cost-effectiveness. Most models did not explicitly incorporate patients' pathway to developing preventable chronic disease, which so dramatically reduces life expectancy. Only a third of models even predict lifetime outcomes for patients, with the majority not acknowledging any potential impact of an intervention on some patients' lifelong struggle with severe mental illness. Models also often used old and poor quality data to inform their conclusions, with only one model rigorously validated to ensure the accuracy of its results. So channeling George Box's all models are wrong, but some are useful. To be useful, economic models must be sufficiently complex to capture all relevant events which are likely to affect an intervention's cost-effectiveness. They must be built using good quality data and should be tested to ensure that they produce accurate conclusions before being used to inform policy. Economic models of severe mental illness have a problem in all these regards. This undermines health payers' confidence in the quality of evidence used to inform investment decisions in severe mental illness, and this should be addressed as a matter of urgency. If you'd like to read more about this research, you can find our recent publication in the British Journal of Psychiatry or contact us directly. Thank you for your attention.